Right, ladies and gentlemen, this is first of a series of practicals we have scheduled for this year. The topic for discussion today is atherosclerosis. Now, under normal circumstances, we'd like to show you some slides as well and add in some text to these slides as well. But for now, it's going to be mostly pictures, photo micrographs, and gross pictures as well. Now, the topic for discussion today is atherosclerosis. I'll try to focus more on the gross and microscopy. For rest of the details, you can refer to your lectures. Now, if you had a lecture about atherosclerosis, I'm sure you need you know a lot about the about things like major and minor risk factors, etc. So it is said that atherosclerosis and the lipid deposition inside the vessels, inside the vessel walls, on the inner surface of the vessel walls, can start even from the age of 10 years. Some say 7 years even. Probably diets today have a causal relationship to this. But how it looks like on morphology, gross morphology, you can see this is an advanced stage. Here, this thing represents a fairly advanced stage, but you can see if you look closely here, there's a yellow patch, a yellow colored patch. Now, there's another yellow colored patch here as well. So these are the earliest lesions. These are this is how it looks like in the earlier versions of the disease, early on gross morphology, and this is the advanced version. So these look like some yellow streaks, some yellow patches in the earlier versions, and later on, when ulceration develops, please refer to your lectures where they must have talked about the stages or the steps, how it progresses. First, a yellowish plaque-like thing develops, and then there may be complications like ulcerations, thrombus formation, etc., etc. So these here are the earlier lesions, and then it's an advanced lesion. Here, this is a fairly the disease here has fairly progressed. You can see some of the earlier versions of the disease, like these, and the advanced versions are here now. Here you can see ulcer formation. We have noticed this in the previous slide as well. But what has changed, what has further progressed in this gross picture is that a thrombus has also developed. Now, you may be asked in an OSCE to point, or they may have marked the different stages, and they may ask that, okay, mark this one, what is this, mark this complication, or mark this one. Okay, so you may need to separately mark these, may be required to separately identify these different stages. Okay, now we talk about microscopy of atherosclerosis. This is a cut section of an atherosclerotic plaque. Now, this is the vessel itself, and this is the area where an atherosclerotic plaque has developed. Okay, this is the lumen of the blood vessel. Okay, and this area is the necrotic center of the atherosclerotic plaque, which is comprised of different kind of lipids. Okay, and this area is the fibrous cap. So this here is the lumen, this here is the fibrous cap, and this is the necrotic center containing different cholesterol esters, etc. You can see the details again in your lectures, in your books. So this is the basic structure. You may be required to mark or identify different parts of this atherosclerotic plaque as well. Okay. Now, this is these two pictures represent complications that have developed. This arrow is pointing out here to a complication which we have seen grossly. This is where an ulcer has developed. You can see there is a breach in the plaque, and when an ulcer develops, the plaque becomes vulnerable to thrombosis as well. And so this is what has happened here, that in a pre-existing ulcer, due to a pre-existing ulcer here, you can see the mechanism by which this occurs in your lectures. This is where a thrombus has also developed. So these are the different complications that are depicted on these photomicrographs. Okay, so this is it for atherosclerosis. If you have any questions, please let me know. Thanks a lot.